Welcome back. It's like midnight. It's almost 12:30. We had a really long day, but I'm doing these daily updates. I'm in Boston at the Elevate Derm East conference, and normally I go live on the weekends and do these weekly nurse practitioner diary series, nurse practitioner entrepreneur diary series. But I thought it might be really nice if at the end of every day I come on in the morning on my social media platforms and talk about the agenda for the day. And then at night, I should have my I come on live YouTube and give a recap of the day. So it's late. I'm going to try to make this really quick. So today we're going to talk about, so we're going to do a wellness chat. That's always important to keep that in mind, no matter whether we're talking about our career or professional development. Wellness has to come be on that list. The D&B Derm group, I can't believe that I actually have updates since yesterday. The nurse practitioner, the dermatology nurse practitioner starter kit, conference strategy, and I'll share some of my notes from today, some of the high points, and then do a little bit of a glimpse into what to expect for tomorrow. Okay, so if you're new here, welcome. I'm Kimberly Madison, a doctorally prepared nurse practitioner, and I use social media to just share my journey as a source of inspiration to provide a blueprint and a living case study, because nursing school only teaches you about patient care. It doesn't teach you about charting, optimizing your time, templates, dot phrases, smart phrases. It doesn't teach you about skin of color, LGBTQ plus community, rural health, insurance, cost of goods and services, contracts, negotiations, and malpractice, the industry, how to get consent for pictures. And you're like, oh, I'm going to learn all that on the job. And some people learn a good deal, but it's no one else's responsibility to teach you everything. And so I hope just by sharing my story and all the other experiences you have, all the other mentors you encounter, that I can help you in some way. If it's just making you aware, making you curious, motivating you, whatever I can do, I want to play a little role in that. So I hope you find my resources are helpful in that regard. And then, yeah, so let's get started. So wellness. So I promised yesterday I have all my goodies to show you. So I've mentioned a couple times now that when I went to the eye doctor, they said that she saw a little bit of cataracts, and based on my age, it's being attributed to sun damage. And I do spend a lot of time outside, and I have not always worn my sunglasses. I'm very good about sunscreen and hats and some protective clothing and shade. I wasn't good about sunglasses. So I got these ones that are by Deion Sanders. I forgot the name of this one. I think it's like coral. Oh, I just love these glasses. Look at that. I love it. And I had said that I'm able to run with these, and they stay on really nicely, but they just feel so good. I think they look they look good. Yeah, I've been back for a while. I already showered and everything, because after this video is off, I'm out. I'm gonna knock out. And then I told you I got my new compound for my face. So I was doing, in addition to these like weekly diary series videos, I was also doing skincare videos because to check my journey, because I have melasma and atopic derm on my neck. Sometimes I get the AD other places too, but this is 24, so 22. The winter of 22, I had out of nowhere, this really bad AD flare. At the time, I didn't know that's what it was. But I would wake up in the morning and my neck would be on fire. And I would scratch it like it was uncontrollable. And that went on for about a couple months before I even realized it was my hair. Anyway, you'll have to go back and watch those videos. And so now I see a derm PA out in Reston, Virginia, Leah Waller. Shout out to her. And she put me on a regimen to treat the AD, which we did get that pretty well under control. And I think a lot of it was also because of the weather. But even from the beginning, in addition to treating the AD, she's also been treating the post-inflammatory hyperpigmentation from those flares, and then the melasma. And so I think in a recent video, I said something about 6 or 8 weeks. But that's a lie, because I've been making these videos and I've been seeing her since January. So it's been 6 months that I was on a compound with hydroquinone 4%. We did that for 6 months. I took a break all of January, June, and now we're on a new compound and actually a new pharmacy too. Oh, I should add my other one. But anyway, old videos I've showed what the other one looks like. So this is I'm still using the hydroquinone on my neck, and I forgot what else is in there. But for my face, because when I went and saw her a couple weeks ago, she saw some more pigment on the sides. I'm in the middle of taking out my twists. I thought I might be able to do that while I talk to you all, but I forgot I have all this show and tell. And so she saw some extra pigment, and so she recommended. Well, we talked about some options, because actually, anyway, in a video I've already talked about. So anyway, this is my new compound. It's a new pharmacy. So this is a gel-based product, and I guess I could show it to you. It wouldn't really be show and tell. And so this is what is this one? This is azelaic acid and kojic. And so, could you see the gel? I don't know if you were able to see that. So even though it's a gel, it's creamy. It's really nice and moisturizing and smooth. Because the other ones I had, they were kind of gritty. And so yeah, this goes on my face. And so far I haven't had any problems. I'm really big on moisturizer first, and I've been even more heavy-handed with that because I think I was having some irritation along the line here. So I've been more heavy-handed with my moisturizer. So that's that one. And then I was talking about sunscreen. And I wanted to share this other one because I've showed the CeraVe one I wear and the La Roche and Thelios one. I don't have the tinted one of that. And this one isn't tinted either. I think I got this at a conference. This is Isden's. Broad spectrum SPF 50 is designed for actinic damage. So basically with this Isden line, which I'm not an expert in, but I've heard a lot of dermatologists talk about how it reverses skin damage. This is 100% mineral. And so I love this one. It's great for, it has a white cast, so I don't wear it on my face. This is another one that I just wear for like when I'm running. The white cast isn't terrible though. It's actually not too bad. It's pretty subtle. The lighting's bad in here, so when I get back home one day, I'll do a better review. And the white cast is really, really subtle. So there's that. And then let's see. I don't know, it's kind of late. I was thinking I might be able to wake up early and go running. But I did do a lot of walking today. So that would probably be the most wellness. And then I did better with water. So that was good. As far as wellness, I wanted to talk a little bit about PTO. And recently I heard someone call it pretend time off. So while I'm talking to y'all, I'm going to do this. And man, I just think that's so accurate. Because especially as a provider, depending on like who you work with, how your setup is, you might be able to like completely be disconnected when you're on PTO, like for a conference. But otherwise, you're probably still plugged in a little bit. And I think that's just, I don't know if it's something you really think about until you're in that position. And so for me, I let everybody know it's going. And then I set a little thing out of office on my email. And then, but I still have my phone. But what I decided is I just answer it. I just look at it like once a day. But I'm not sure in the future if I might not even do that. I'm not sure, to be honest. I kind of like the once a day, and I was pretty disciplined about that because you really do, and it's time off, so you really should try to do that. Really be disconnected, right? You owe that to yourself. So I think in the future I might do that, and just because I didn't tell the people that I had kind of already finished what I needed to do. I didn't really talk to them about being off, and so they kind of contacted me, and so it made me rethink about how I handle that. So yeah, if you have tips and tricks on how you handle that, and I know some people, I've seen them at conference still working even at the conference. So yeah, I'd just be curious to hear how you handle that and what your thoughts are on PTO, pretend time off. Um, so I can't believe I have another update on the DB Dermatology MPPA group. So if you don't know, that's I founded that group. It's a networking group for NPs and PAs in DC, Maryland, and Virginia, practicing or aspiring to practice in medical, cosmetic, and surgical dermatology. And I just announced that we're expanding into Blacksburg, and today I'm announcing that we're expanding into Richmond, Virginia. Man, I did not anticipate that at all, but really excited to see that happen. I could probably definitely join that meetup. For Blacksburg, that would take some planning for me to get out there because that's about 4 hours from like Northern Virginia. So, but you never know. You never know. And actually, now while I'm thinking about that, I am going to be heading out that way. Maybe I should try to make arrangements so that I can be there, at least, especially for the first one. Oh man, I just thought about that. Okay, so I'll keep you posted. The person who's there, I'm gonna talk to him, and he'll kind of be like a co-partner with me on that one. So stay tuned. And then, yeah, don't forget, I just released the new Dermatology Nurse Practitioner Starter Kit. You can catch that in the virtual Preceptor shop. That is just like my recommendations for resources just to get you started, get your foot in the door um, with reading, finding out the latest evidence, kind of like learning more about the industry itself and practice, gaps in knowledge, gaps in practice, conferences to attend, organizations to join, just so you're not too overwhelmed with too many options and you can just kind of get your foot wet and see if it's if it's everything you thought it was going to be. And also, what I would love is that it just expands your perspective. Because I know a lot of people are getting attracted to derm because of social media in particular. Um, and most of the videos are like aesthetics and that's appealing. It catches your eye. Everyone looks so happy, especially if you're coming from bedside, and it looks really attractive and just something new and different. And it is a great field. But I just think it's important that you learn all the difference between all of them, the benefits, what it means to practice all of them, what it means to focus on one at a time. Um, yeah, before you just jump in, because it's going to be an investment, whichever one you pick, because you have to do your own education and training. Um, just so that you have an idea of what you want, right? Because even I thought I was going to just focus on aesthetics or cosmetics, but then I just fell in love with medical derm so much. And I still like the cosmetics and stuff, but right now there's just so much to learn. And so right now I'm just focused on medical derm at the moment. So yeah, I just hope the starter kit helps you. You know, if you're curious and you just want to know. And all those resources are highly recommended by people who've been in the game for a long time and or they've been established for a very long time. The resources. Um, oh, so I brought that up primarily because I'm talking about the virtual preceptor shop, and so I get a lot of inquiries now. It's kind of increasing for mentorship. And so right now I don't charge for mentorship, but what I do recommend and might even start requiring is that you purchase the nurse practitioner mentorship match ebook, which is a downloadable guide. It's PDF fillable. You can use any PDF reader you want, and it's a bunch of questions. There's scripts on how to initiate conversations for potential preceptors, mentors. Gives you a chance to really reflect on what you think it is you're getting into when you want to get into healthcare and nursing and being a nurse practitioner. Helps you identify who you are, where you're trying to go, what kind of support you need, all those things. If I'm going to work with someone, I don't want to sit and be like, and who are you, and all these other things, right? So it's really great if you can come prepared for that, and give you a head start on like how you want to pitch yourself, because that's what you're going to be doing. And these questions in the book are the same things employers want to know, scholarship committees, So when you take the time to do these, it will be time well invested because you'll be able to use them over and over and over again. And the more time you say it, the more confident you become. Um, and then now, and by saying it out loud, you recognize what it is you need. And so when you have opportunities before you, and you look at the advantages and disadvantages, pros and cons, you'll automatically know that doesn't even align with what I've been saying about myself. So that's going to have to be a no, or we're going to have to go to the negotiating table because everything is negotiable. So, yeah, that's a book I recommend. So, let's see. Okay, so let's talk about the conference. I wanted to share, which I think I've done before, how I take notes. And so I love OneNote, and shout out to the MP that I shadowed in Colorado, because I got this from her. She does this both. She would do this in conference, but also in clinical practice, and so that's why I really loved it, to be able to see that it works in practice. So it's the Microsoft OneNote, and you can create tabs. And so I need to do an article on the blog so I can show you some screenshots. But like on the side, you can have different topics. So like I have a derm, so I have a derm notebook. I have other things on there, right? Like business coaching notebook. So when I click on the derm notebook, it has different pages. So it has like acne, atopic dermatitis, like all these diseases are on there. I can't even think of at the moment. So every time I listen to a lecture, go to a conference, participate in a webinar, I just go into there and update the notes, right? Because inevitably you don't catch everything someone says. And so the next time I listen to a presentation, a lecture, when I'm reading, I just add on to my notes, which I really like. So I love it. And I know about the old school, write everything down. And you know what? It's not a bad thing, especially when you're studying for something. That repetition is really helpful. I used to write things over. I used to write things. I think I had heard the magic number was 11. So I used to write things 11 times and then to help me remember it. However, I live a very busy life. I'm a multi hyphenate, someone who does a lot of things. And so writing things, I'm always trying to find things that are efficient in implementing it and retrieving it, right? So you're putting down data on your notebook, but then you need to retrieve it at some point. Otherwise, what's the point? And so with the notebook, the electronic one, you can search it. And so to me, that's really beneficial. But yeah, so I love that. And I even will copy paste images. So if I take a picture of a slide, like at a conference, or if I'm doing like a webinar, I just take a screenshot and then I paste it right into my notes, which is a huge time saver. And I use this in practice too, in my own practice. I have a notebook for my job, and yeah, I'll pull that up in a second. And when someone shares information with me, I go over there and I find it, and it's very helpful, very convenient. And I always have it no matter where I go, which is not the case if I have a paper notebook because then I rely on my memory, which I wouldn't recommend. So yeah, so today was super exciting. So let's see. We had, well, I talked to you all at breakfast. My breakfast was delicious, by the way. That was a falafel salad. Let's talk about the food. Food was so good today. I was super happy. So I didn't have breakfast here because I got it out at Life Alive. And so for lunch, we had like was that lunch? I don't know if I'm gonna get these meals mixed up now. Okay, yeah, I think that was at dinner. Okay, so for lunch we had like a stir fry kind of thing. It was so good. It was so good. And it was vegan, and then there was rice, and there were some soba noodles too. And like they have all the little cards out next to the food, so you know what the food is, what the ingredients are, and then they'll highlight like that common allergens. And so if it's vegan, it'll say V, or non-dairy, things like that. Like it'll say that it contains dairy. And so I think for the soba noodles, it didn't say that, but just over the years, I just typically have stopped eating. I stopped eating things that were creamy because usually creamy things have dairy. So even if the label says it's not, I just kind of have gotten out of eating those kind of items. But the best thing was they had these like the goiza dumplings, because they've had pork. I've seen pork a couple times now. So I thought it was just gonna be like pork dumpling, whatever. I wasn't even gonna look at it twice. Then I saw that it was vegan, so I was so happy. So lunch was amazing. For dinner, there was like a baby green salad. Was that fennel? There was something on top. I can't remember if that was what that was. But then sliced pears, and then I should have took a picture. I just remember the salad. I think there was a quinoa mixture with like edamame and some other toppings. And I had three things on my plate, but I can't think of what the other thing was. But it was really good. And just the fact that it was vegan was made me super happy. Um, yeah, so that was, and then we still had like our little mingle zone with snacks. So they had sliced apples with like peanut butter sauce, and we have these. What else? Oh, so I don't talk about it because I didn't eat it, but they do. I have seen like, I don't know if they're brownies or just like little chocolate cakes, and there's other little cakes too. So I don't know if those are cheesecake or not. But there've been other desserts that look really pretty. There was even one that looked like chia seed pudding, but the little ingredient card said it had dairy. So I didn't try that one, but that would have been really delicious. And what I was thinking is like, man, what would be my recommendation for breakfast? Because breakfast is always a challenge when you're plant based, especially if you don't want to just eat. If you don't want every breakfast to be just like carbs, bagels, donuts, muffins, croissant, what do you call it, danishes and stuff. So if you're looking for something else, my recommendation would be oatmeal. You could do an oatmeal bar and just change up the toppings every day. Always include some fresh fruit, different seeds and nuts, and have fun with that. But also, you could do chia seed pudding because First Watch has a really delicious one. And I could eat that every single day. In fact, I haven't had it in a while. I'm gonna need to get that when I go back. So yeah, good job on the food. And there's lots of beverages, water, um, different kind of drinks, soda, bubbly, tea, coffee. So lots of stuff like that. Still very cold. I was still so cold. So I appreciated the scarf that they gave us. Let's see. So yeah, so I missed Dr. Schultz's finishing up on her lecture on immunobolus disorders. So I can't tell you about that. And then we did Trimfia. That was for psoriasis, and we did melanoma updates. I'm gonna go over my notes actually with you all. Oh, and I was so surprised to see Dr. Kirikoff. She came and did. Oh yeah, so let me show you this, and then I'll look at my notes. So Zarif. So speaking of the DMV Dermatology NPPA group, when we had our first meet and greet last month, it was sponsored by Arcutis, and they came out and taught us about the already two indications for Zarif or roflumilast, and how they just days from that meet and greet, they were going to get a third indication. So for the first one, they have a cream for psoriasis, and then they have a foam, a topical foam for seborrheic dermatitis. And the newest one is for atopic dermatitis. Love this stuff. I should have brought the one I already opened. I was going to show you all, but it's a cream, and it looks really just like a moisturizing lotion. It has like a nice little thickness to it, but I loved it. It wasn't sticky. It was very moisturizing. So the great thing about this is it's non-steroidal. So you can use it in intertriginous areas or skin fold sensitive areas. There's no time limit on it, unlike topical steroids, which you're trying to stick around that 2-week mark. What else did I want to say about it? It reduces post-inflammatory hyperpigmentation, which I just told you about is a big problem of mine. And they had some pictures to show us with it, skin of color pictures. Actually, when they do their research, that's a big component, is that they include patients with skin of color, which is important whenever you're going to promote a product, is that you can speak to the research on it, the inclusion criteria, and the limitations, as well as any disclosures you might have. Yeah, and then you use it once daily, which everyone can appreciate. So yeah, I think I covered all the main ones. The price they were programmed to really make sure it's cost effective and help everybody get access to it. And so the lecture that she gave today was the first one in this country since the new indication was released. So yeah, she's on there. So actually, quite a few people on here have come and spoken for us on diversity and dermatology. So yeah. So that's that one. So let me pull up my notes. We can talk a little bit about derm. So for melanoma, I think the main thing I want to point out is how at high risk transplant patients are for melanoma. That is a big deal. Now, another thing she mentioned, there's a bunch of mobile apps out right now that make claims that they can help identify melanoma, but there's no FDA approved ones, by the way, just so you know, which is interesting. A lot of really great research ideas came up today in listening. Oh, another one I really liked was let me finish the transplant note before I forget. So, the most of your transplant patients, those at highest risk, are those who are the most immunocompromised, which are your people who have had a heart and lung transplant, and then kidney comes after that. So I don't know if I shared on here, but my dad had a kidney transplant. So whenever people talk transplant, they have my undivided attention. So I was really listening closely to that one. And then, let's talk about some consensus data here. So when it comes to screening first, what she said was fascinating. So when it comes to creating sunscreens, there's no regulation that requires them to test it beyond Fitzpatrick 3. So 1, 2, and 3 are the only ones they have to test it on. So that makes so much sense why so many of them, that's changing, but for the most part, you can say so many of them had that white cast for the longest because they never had to test it on people where a white cast was even a problem. And then, so that was fascinating. Let me see, did I write any more down? Fascinating isn't interesting. And then the other thing that we spent quite a bit of time on is what's called active surveillance. And so that's an instance where someone might have, it kind of reminds me, and actually, she said it too. She said it with prostate cancer, how we watch and wait. That's kind of just like active surveillance, but it's not like it wasn't just a simple thing. Like it's actually a really in-depth conversation that you're having with your patient. Kind of like decision. It's kind of like I don't know if I would call it shared decision making, but motivational interviewing a little bit. I guess it's kind of shared. It's shared decision making. It would fall under there. Um, yeah, and the longer someone's on immunosuppressive therapy, the higher their risk for squamous cell. And then those who had organ transplant are 9 times more likely to have skin cancer mortality, and that exceeds the mortality rates for breast and colon cancer, which is really significant. And I don't think those are people who aren't in derm. I don't know that is emphasized as much outside, which makes sense why they spend so much time talking about it. So for the active surveillance, this is primarily for non-aggressive basal cell carcinomas in low-risk locations, and where life expectancy is kind of on the lower end. But it's important to note that we don't really have like a specific, even nobody knows what somebody's life expectancy is going to be. Yeah, I think that's the main thing. that I found interesting was the active surveillance for the melanoma. I mean, there was a lot of things, but that's the only thing I really want to bring up for this. It was actually really good. And that was with Dr. Hartman. And then let's go over to acne. That's a popular one. And so we talked about acne and also with like skin of color. That was a part of the topic. So when it comes to acne and skin of color, which, I can relate to, the top concern is is typically the pigment, especially if you've had post-inflammatory hyperpigmentation and scarring and a lot of irritation that's led to blemishes and dark spots, more so than the disease itself. And I would say, and you could probably argue that when I do my videos, even I don't talk about the AD as much. I always talk about the pigment. Let's see, any little nuggets I can share with you on acne? Oh, we spent a good amount of time talking about benzoyl peroxide because there's been a lot of concern in mainstream about benzene. And so the recommendation for that concern, because we've been using it for so long, and that by now, if it was really a really big concern, we would have had a lot more data and evidence to support that, is to encourage people, especially if they're concerned, is to keep it in the refrigerator. And then if you don't end up using all of the bottle within like 3 months or so, toss it out, get a new one. Those are the main recommendations. Really good amount of time was spent on different treatments, but especially isotretinoin. And I really appreciated these talks. Actually, they were really in depth and very conversational, and a lot of good attention brought to pregnancy, which I don't think enough attention is, and also for patients who might be taking testosterone for gender affirming care too. I appreciated that attention to detail. And then let's see, that was acne. And then last thing I think I'll review will be the Cosmeceuticals. That was really good. Oh, we did the quiz bowl. So it was kind of like rapid questions. That was in the middle of the day. And then in the evening, we did PCE. If you're not familiar with PCE, I don't remember what all those letters stand for, but it's like clinical exchange. I don't remember what the P is, but I do these a lot. They're great for CEs. I'll put that in the description box. But yeah, and I've seen so that sometimes they film. I guess maybe all of them are. Some of them are. They do a lot of live ones, and then they'll post it for on demand, just like the one today. So it will be live. It will be available later. And we went over the guidelines for atopic dermatitis, which I'll have in the description box too. Was that atopic? No, yeah, it was atopic dermatitis. And that was good. Went over biologics and JAK therapy. And yeah. So let's see. Okay, so cosmeceuticals. And then we'll talk about cosmeceuticals. And then we had our nautical theme. So I hope you see my thumbnail. You can see some of our fun outfit from there. Yeah, that's the thing. It feels okay. So it feels like it's on. Okay, yeah, there it is. I feel like I would put it on and think it was straight, and then when I look in the picture, it wasn't. So we had these. They had on cute little outfits, even for the bowl. The two who went up there, the two leaders, they had on like cute little like jersey kind of shirts, and they were really into it actually. So yeah, these are cute, and they had a cute little backdrop with the sail with the I don't know what you call it to steer the ship. You can see it in the thumbnail. But yeah, that was cute. We had our drinks lit up, and there were two like specialty drinks. They were dueling pianos. There were little snacks because we had already eaten at the CME dinner for the atopic derm new guidelines. That's where we ate dinner during that. and we had little I'm going to call them clickers for the sake of this conversation, but they weren't really clickers. You actually had like a QR. Was there like a little QRT board? Like it had numbers and letters. I think I didn't really pay attention to that, but I think it was like a regular keyboard. So we were able to participate and submit our answers through there. Yeah, and that wrapped us up. At first I thought I'm going to stay the whole time. Then I said, no, I'm going to go. I'm going to go early. And then I stayed the whole time because I met some new people. And man, I just can't emphasize the importance of networking outside of your job. Just learn so many things, get motivated and perspective, and it's really, really appreciate being here. Oh, and I did catch up with a friend of mine. I took a little break, one of the non-CME dinners. I didn't attend because I caught up with a friend of mine. And so we walked around here in the commons, and it was just really nice. So yeah, let's end on Cosmeceuticals. Let's see what little pearls I can say over there. We had 2 lectures on it. One was like a general overview and the status of them. And then there was one dedicated to skin and color. And so we start off talking about the definitions and what is and what isn't considered cosmetic versus a drug. And so basically, let's see, this would be my opportunity to teach and retain, which is one of my number one tips for trying to retain information, is to try to explain it back. And you have to say it out loud. I know everyone wants to say, yeah, I got it. But it's not until you say it out loud where you realize the gaps are. And then it's immediately noticeable. Then you can immediately fix it, turn it around, move on. So for drugs that for cosmetics that want to be a drug, they can make claims about changing the structure and function of the skin. But if it's not a drug, it doesn't meet the criteria, then they can't make those claims. Only thing they can do is say that they can give the appearance of, and then, whatever it is, appearance of fine lines, appearance of less redness. You can say that language, but you can't make it a claim if it's a cosmetic. Hopefully I explained that because I feel like I'm falling asleep as I talk to you all. Oh, and sunscreen is technically an over-the-counter drug, so neither one of those. We did a whole thing on the clean debate in terms of products that are clean. That's what consumers are asking for, clean products and chemical-free. But it's always important to point out, like the periodic table, those are all chemicals. And on there is oxygen and water. Well, you can make water from it, so it's just about educating ourselves and educating our patients on what is and isn't appropriate for them, regardless of all the other concerns or stuff that might come up. It's good to listen to them and to know they're aware, but also to provide that knowledge deficit that you might notice. I don't know if any of this makes sense. I'm falling asleep. Let's see. Anything else I want to add? I think I have a much greater appreciation for hyaluronic acid after the talk today. Yeah, I want to say that. And some really good questions on like blue light and visible light. Oh, that was really good. And of course, we talked about retinoids, vitamin A, and the different derivatives. And also how to address misconceptions and myths. I thought that was done very nicely. So yeah, I think that's all I have. I'm sure there's more, but I have got to go to sleep. And so tomorrow, yeah, I'll join you on my other platform to go over the agenda. But it starts at 7:30, and that's all I'm going to say about it. It's another hair loss one, and so that'll be interesting. And then in the evening, we have a product. We have two. Well, we have 2 non-CME events. One is a dinner that's sponsored, so that'll be exciting. Thank you so much for watching. I hope this makes sense. and that you learned something. So in the description box, you can click on the link for the virtual Preceptor shop to download your Dermatology Nurse Practitioner Starter Kit, the article to the Dermatology Conference Strategy that I wrote a while back, and then the new guidelines for atopic. I don't for the new guidelines for atopic dermatitis. I think these are them. And yeah, that's all I have. So if you have any questions, if you're attending conference soon, and it's your 10th time, or it's your first time, let me know in the comments, and let me know which ones you recommend, which ones are on your bucket list for the rest of the year, and even next year. So for Elevate Derm, they're going to be going to Utah and Tampa. At least that's all I know. There might be more opportunities, but those are the ones that I'm aware of. So thank you so much. Have a good night. I can't wait to watch this back and see if any of this made sense. I'll see you next time.